It may be hard to imagine, but according to the World Health Organization, over 800,000 people die each year by suicide. That is more people than are killed in all the wars and homicides combined. Of these deaths each year, more than 40,000 are Americans. That is one death by suicide every 13 minutes. Suicide affects every region of the world and is the third highest cause of death for people aged 15 to 44. And for every life lost, another 25 people will attempt suicide, often causing serious medical injury or lifelong disability. Today, the greatest loss of life is among working-aged men, 35 to 65 years old. Men of all races and ethnicities are at higher risk. And from the very young to the very old, millions of Americans think seriously about suicide for days, weeks, and even years. Thinking seriously about suicide is itself a kind of misery index, a sign that something is terribly wrong and needs attention. Most often, what needs attention and treatment is clinical depression, a medical condition that is now the leading cause of disability in the world. In America alone, there are an estimated 15 million sufferers. Most of us are touched by suicide. Some of us have lost family members, loved ones, friends, schoolmates, or colleagues. None of us escapes the loss of people we admire and respect, whether they are people we know or are much-loved musicians, artists, and entertainers. If you have lost someone close to you to suicide, then you already know the considerable cost, the tears and awful pain of loss. And if you are one of the millions who have thought seriously about suicide, then you already know just how lonely and terrible it is to suffer alone. Depression, anxiety, substance abuse, bipolar, and thought disorders like schizophrenia all contribute great risk for suicidality. Yet most people suffering from a mental illness do not kill themselves. They get help, they find a way, and they recover to live full and productive lives. And if recovery is possible, that means suicide is preventable. Thankfully, the world is changing. We understand mental illness. We understand suicide. And we know that treatment saves lives. Right now, our teachers don't teach us about depression and suicide. And our faith leaders often struggle to talk openly about these topics. Too often, doctors can't talk to their patients about suicide. Even patients who are sitting in their offices planning how to end their lives, perhaps by overdosing on the medication being prescribed to them. The world remains dangerously ignorant about suicide. So to save lives, we must bring this subject out of the shadows. Effective treatment would save thousands of lives around the world. But we must learn to talk comfortably about suicide, and we need your help to start the conversation. Join us in this fight, a fight to save lives. Preventing suicide, it's what people do.